Hello, good day, YouTube viewers. I'm Priscilla, and as discussed in the previous video, the whole intent for this platform is to discuss anything to do with nursing research. Today's video will be discussing about figuring out and making sense of a phenomena regarding nursing research. Like I said, I'm Priscilla Bekwe. I'm a registered general nurse, a critical care nurse, research intern, an HRA, research ethic committee, expert reviewer, and a Sigma nurse. So, content for this video, we will be diving into the objective for this session, the introduction. There'll be a bit of a diving into what figuring out and making sense of a phenomena in nursing research really means. We'll have two exercises where we will discuss on the platform and about the exercise and the conclusion with regards to the whole content. So, the objective for this session is to simplify nursing research and help the learner understand the basics of nursing research, figuring out and making sense of a phenomenon by the end of this session. So, to start with this, I would like to talk briefly a bit about nursing research. Nursing research is a systematic and objective way of identifying and analyzing a phenomenon that is related to nursing. A phenomenon, obviously, is a chosen topic or subject to be investigated. As nurses, by the bed space, even clinical academics or wherever we are stationed as a nurse, most of the time we're faced with dilemmas. There are, questions or queries with regards to our practice. What nursing research does is that it provides a systematic way of identifying and analyzing these queries or phenomenon, which we identify in our nursing practice. Research is done with an intent of informing policy, practice, and understanding a field of study, or testing out, a concept or an idea. Basically, that's the whole intent for nursing research. It contributes to the body of knowledge. It's all to do with the profession and providing evidences of which nurses can work with regards to clinical practice, education, training, and all of that. So figuring out, when we talk about figuring out, it basically means finding out, observing, studying, researching, or discovering. So like I said, in our clinical practices day in and day out, we are faced with dilemmas. So the process of finding out, the process of observing or studying or researching, a query, and making sense obviously means that, it's a process of trying to make sense or, sorry, comprehending or understanding that phenomenon. So if you have identified a question or a curiosity with regards to your practice, the process of making sense of it, which is understanding or comprehending whatever that query is, basically means making sense of. I believe most of us understand this, so we'll just dive a bit more into that. When it comes to nursing research, it is more to do with understanding the subject or the topic to be investigated, more than just identifying new theories or new ideas or concept or way of practice. It's usually begins with understanding the subject to be able to undertake the research rigorously, and that's the reason why figuring out and making sense of a phenomenon is very important, because that's the basis of undertaking the research. And so we'll dive a bit more into that. So figuring out and making sense, as humans, we often observe, things around us and make judgment or sense of it, whether an experience or a knowledge we acquired, which simply means we're making sense of things. So if we find ourselves in an environment, maybe in a bus, we see someone maybe limping or someone using a crutch. I mean, it depending on the person's, presentation. Most of the time, we do, we make judgment. We could maybe think that probably the person, had fallen, or there is a condition, or maybe it is to do with, pain. We make judgment of whatever we observe, and that's something we all do. It's something innate to humans, and we as nurses, for example, when it comes to, you know um, our practices, we do observe things, and sometimes we do make judgments out of it. And some of these judgments we do make most of the time are usually influenced by our perception, our culture, race, age, gender, and all of that. And when we are puzzled about something, we normally would, search for evidences to help us make sense of it. For example, when you're on the unit and you turn a patient and you realize that, there is a blister, you would most of the time would want to, or maybe there is a line marked on the patient's skin. You most of the time would want to understand or identify the reason for, maybe by checking to see if the patient is lying on the line, check on in their note to see if the patient has not been rolled for a very long time. All these things are some of the things we do to make sense of, what we observe. And so, when it comes to research, research is an extension of our common sense, what we usually do. So with research, you're just not making assumptions based on your perception. It is more to do with that. With research, there is a systematic approach to identifying the reason or identifying the evidence or making sense of whatever you have observed. And so that is the difference between, the things we do on a normal basis, which is making sense of things, which is common sense, and then what research is. And obviously, most of the time when we talk about research, most of us things, it's very mysterious and technical, and that you need long hours of training and to be able to undertake research. But I want us to get from this session is obviously you need some sort of training to be able to position yourself, to be able to conduct a good research. But then it is not far reached. It's something that each and every one of us can do. And that's because it's something we do. It's just going a bit, further, a step forward from what we do normally. And so I hope this session will help us, be able to understand that and incorporate that into clinical practice and not think that is something we cannot do. Okay, when it comes to common sense, it has limitations, like I said. So for most of us, we it's it's bounded by you know perception, culture, a background, an assumption, and obviously common sense act on poor facts with little or no evidence. Contrary to that, research do act on empirical evidence, So empirical evidence, obviously, it's the data or information that has been acquired by systematic, experimentation or observation. So it is just not, someone sitting somewhere and making assumptions of things. This is something that has been tested and proven. So research, like I said, go beyond, you know, um, the common sense, which is limited by poor or little evidence. It's more than that. And so, for example, if let me just take an instance. For example, when as a bedside nurse, I've been, you know, observing that in the unit, the nurses roll the patient every 2 hours. Another unit, the patient is rolled every 4 hourly. When it comes to good research, there's got to be an evidence, an empirical evidence against that standard of practice. But then, obviously, some people may think that, oh, if rolling patient is good, then rolling patient too early, seems a bit reasonable, and so let's stick to rolling patient too early. However, a person with more, when it comes to research, you would want to go further by undertaking a study or an inquiry into rolling the patient too early and rolling the patient for early. It could maybe not necessarily mean that rolling the patient too early is more effective compared to rolling the patient for early, which you might think is the right way to do it. But when you do the research, if you do a proper research using the systematic process, the evidence may, be contrary to what you think, you know. And sometimes you might want to factor in certain things like, the feasibility of it and all of that. So that's something that we should be, thinking about more, not just, making assumptions of things. So there are going to be two exercises, and these exercises are looking, with these exercises, we'll be looking at, your environment or a person and observing what is going on, asking questions and making sense of the observed happenings. So with these exercises, you take 5 minutes to observe, sit somewhere else, serene environment after the observation to write some note on what you have observed, not more than a page. And so let's dive into that. So the first exercise is in a clinical setting or ward, spend 5 minutes just looking around, observing what is going on without attracting attention. And the second exercise is spend 5 minutes in a clinical setting, focusing on a nurse or a doctor and observe how he or she interacts with the patient or staff, and check how the patient or staff responds, and whether you know the patient appears satisfied or upset by the exchange. You may decide to do this at the same time, or may decide to do it at different times. It's up to you. But I just want us to discuss a bit more about some of the difference between these two observations, and then yeah, we can make some conclusions out of that. So the first exercise, which involves a general observation of what was going on and making sense of it, it will definitely tell us more about the observer than what was observed. And that's because most of the time, when we are making an inference or a conclusion based on something we're observing, we're trying to make judgment or sense of it by, you know, our, like I said, perception, idea, culture, age, gender, social class, you know. So um, most of the time, the output from such observations can be biased, whereas research will involve a more systematic approach to understand the phenomenon to eliminate biases. So, for example, with research, I mean, if it's going to be a qualitative research, these understand figuring out and making sense of a phenomenon may look more like an approach for a qualitative study, but it could also be an approach even for a quantitative study, to be able to understand the subject even prior to you know developing a hypothesis or testing out her hypothesis, or identifying a topic. There is more to that, but this is just figuring out and making sense of it, which is very important, like I said in the beginning. So like I said, this may look like a qualitative an approach for a qualitative study, but it can't be for a quantitative study. And so I'll take an example for each of them. So for example, if it's a qualitative study, if I have observed that, maybe a certain group of people behave a certain way towards a certain group of people, using a systematic approach to understand the phenomenon would mean that I would, want to, observe, obviously observe, and, understand what's really going on, and not make a conclusion based on that. But obviously, it will require imagination and the ability to see things from various angles. Okay. So you might want to, it involves a lot of thinking. So, what if, what if, what not? And then you definitely would want to, you know, like I said, empirical evidences, do a literature review, and there's a process of doing that, and then get the evidences out there with regards to this phenomenon which you're trying to understand. And then, based on gathering that information and understanding and trying to, view things in different perspective, you can come up with a topic or a hypothesis, which you then, start from. Okay. It can sometimes be not necessarily observing, but there are other ways as well where you do patient and public involvement, where you involve stakeholders, people with expert knowledge. You do a preliminary investigation or a survey or questionnaire with regards to that phenomenon, and then gather information, and based on that, with empirical evidences, you can now come up with a topic or a hypothesis. So this is one way of it. But obviously, in this instance, you don't just assume because you have seen what is going on that that is it. You're taking it a bit further using a systematic approach. It could be a qualitative research where after the evidences have been gathered, you then maybe do a proper maybe interview or whatever discussion, and then you analyze it using a proven or a proven method to analyze it, and maybe involve you know expert reviewers, and be able to come up you know with a scientific reason for why that has happened. Okay, so it is a step further. Okay. Obviously, it involves time, resources, and all of that, but it begins somewhere, and that's what we're talking about. So, this is just to give you a brief understanding of how, making sense of things as an observer, which is normally what we all do, can grow into, into understanding a phenomenon, and then coming up with an answer or coming up with a theory or coming up with a yeah, coming up with something which can be, proving a phenomenon which can be used in our clinical practice, especially when it comes to, clinical practice and all of that. Okay. When it comes to quantitative study, you can also use it can start with, an observation as well. So for example, you have been observing, maybe you did or you work in a different unit where you see them using incentive spirometry, where you see, you know patients using incentive spirometry, and from your observations you realize that most of the patients after a certain procedure who uses incentive spirometry, you know get better. They don't develop pulmonary complications and all of that. And then you try to understand that phenomenon, reading a bit more about that, talking to physiotherapists, people who have got the expert knowledge, stakeholders, and all of it, identifying empirical information or empirical evidences with regards to using incentive parametry pre-op or post-op, and all of that. And then based on that, you don't just sit down and now make an assumption. You then identify, you use the systematic approach to be able to understand the phenomenon, by maybe doing a quantitative study, comparing or comparing patients using incentive spirometry against patients not using incentive spirometry, and then whatever the result is, you can be able to ascertain that okay, using incentive spirometry helps patients maybe pre-op or post-op, a certain procedure, a certain, surgery. Okay. So you initially began with a curiosity, okay, by maybe a general observation, and then you make sense out of it by understanding all, by using the stakeholders and all of that, and empirical evidence and all of that. Okay, and this time around, you took it a bit further by undertaking a research, which is using that rigorous systematic approach to be able to, you know, defend the hypothesis, So that is one way. So the second question is, this exercise, unlike, the first one, involves concentrating on one participant for 5 minutes. So longer than you would normally grant to a person you were not communicating with, obviously. And most of the time, when you do that, you tend to see things differently. So, for example, if you've known someone, if you've known maybe a doctor or a nurse in a certain way, and then one day you just stay behind without them knowing and just observe them from a distance or closely without them obviously knowing about it for longer than you would observe them, you would come up with ideas, something new or strange and surprising, and that could provoke an inquiry. So it all has got to start with wanting, being curious about something and taking the time to observe or understand that occurrence. Okay. So it could be an idea, it could be an observation. It's not just an observation, it could be an idea. So it is. So the difference between the common sense and, research is that you would take more time to do the work instead of just making assumptions. Okay, and so obviously this is a different approach to the first one, because this time around, you know, that observation for that phenomenon, come up with that. And with the first one, which is general observation, could also, whatever you're trying to observe, could also elicit, you know, a query or hypothesis. So these are different ways we could, be able to come up with a hypothesis to be able to, work on, okay, to work on systematically to be able to arrive at an evidence for clinical practice, which is evidence based practice. Yeah. So, in conclusion, although the exercise in today's session was about observing things or people and making sense of them, which leads to an idea or concept, there are several sources of curiosity of which a research question or hypothesis could be deduced, especially in the clinical setting or in nursing practice. Among these are data or statistics. So, if you're on a unit, because I remember on my clinical unit, we used to have, there were incidences with, it could be data or statistics. Maybe in a year, we realized that the rate of infection on the unit has increased from maybe 50% to maybe 80% compared to last year. And that statistics could incite, an inquiry into why there has been that raise with regards to, infection on the unit. It could be that, an incident happened, and that incident will also incite, an inquiry into, you know, whatever has happened. Could be a theory. I mean, a theory, there are so many nursing theories, theories of caring and all of that. It might not necessarily you starting the theory or, you know, something you could, there could be an existing theory which you believe that probably you've been using and it's not working, and you feel there's something a bit, abnormal or unrealistic about, that theory, that could lead to, an inquiry. And so there are various ways other than observing, but the whole idea of this is for you to understand that it's not just about that. There is more thinking to do with that, which we do most of the time. But this time around, it's a step further where we do understand the phenomenon, which is very, very important, especially when it comes to research. You really have got to understand the subject you're dealing with. You have to be in command of the phenomenon, of the subject. You know what it is. And then based on that, you can be able to imagine, think, eliminate, and all of that. And based on empirical evidences, you can be able to come up with a topic, and then, work your way through to the research. So I hope that we've learned, something today, and looking forward to our next session. So I'd like to say thank you so much for watching, and please like, comment, subscribe, and share. And thank you so much. Bye.